And that was amazing to see how much one can perceive if you really pay attention. And a lot of it was just those first impressions. It's not that I'm necessarily right about all of that, but it's interesting how much people will show you and tell you about themselves if you let them, if you let it in.
I'm Michael Max, and this is Geological. What is the name of the problem people are trying to solve? Patients usually come to us with a diagnosis, a story, something that motivated them to seek us out, take time from their day and money from their pocket as well. If you've practiced for any length of time, you probably noticed by now that the air quotes here thing that brings people in our door might only be tangentially related to what eventually unfolds as we work together. I used to think that people were not being straight with me. Later, I realized that we often are driven by a storyline that doesn't really make a lot of sense to us. As patients, we have an idea of what's wrong with us. As practitioners, we have an idea of where our patients' difficulties stem from. And then there's the reality of the situation that unfolds if we are attentive to it. And there's the rub. How to allow ourselves to both be firmly rooted in our work and perspective, and at the same time, open enough to recognize that we might be wrong or mistaken. It's easy to allow our attention to be caught by how our patients frame their problems. When we do this, we get trapped inside the boundaries and confines that they also are trapped within. Our job is to bring a wider perspective, hopefully one that allows other possibilities to unfold. And don't underestimate the resistance you might get from your patients. Of course, they want to get better, but it can be disorienting to have healing or change arrive from a direction to which you are blind or have little experience with. Our minds love to categorize life and experience by what we already know. And so, when someone gets off your table and says, "Is it possible that my pain can really be gone?" you'll know they are in a tender new territory. Everything in them says that it's impossible. So my question to you is, how do you help patients live into these emerging moments in life for which they have no reference experience? The name people call their problem by frames the possibilities that are open to them. How can you help your patients to see their experience in a larger context, especially when things start to change and they have no good story for how that could be possible? And I'm not talking here about giving them your version of the Chinese medicine story. That's like asking someone to believe in your religion. I'm suggesting that there's a way to take their story of the world, and if you've been listening carefully, help them to widen it a bit from their own frame of reference. Many of you probably know there is quite an overlap between Chinese medicine and old school osteopathy. We're going to be getting into sensory listening to the body with Josh Margolis here in just a moment. But first, I was just talking about state acupuncture associations, and I suspect when I said those words, some of you nodded in agreement, but a larger number of you probably rolled your eyes. I get it too. I'm not exactly the organization joining kind of person myself, and I think it's really important that we support our state organizations. There is a political economic world out there that you might not want to deal with directly, but there are people in our profession who are called to help protect our practice in that realm. Joining your state organization helps them to do that work. Just ask the people in states where the state organization was able to keep out dry needling. Or, better yet, the states where they didn't have enough support to do that. So you might not like politics, but you ignore it at your risk. So please do consider joining your state association as a kind of inexpensive practice insurance. All right, I'm off the soapbox. All right. Pull up that cup of mountain oolong or whatever you enjoy drinking when you're ready to put on your thinking cap and learn something new as we get into this conversation with Josh Margolis. These conversations come to you through the generous support of our sponsors and members. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. It's Women's Health Month at Mayway Herbs. Check out their new website for learning resources on helping women with herbal medicine. Are you a creature of habit? How about making a change that helps your patients and the planet with AccuFast needles? And later in the show, raising your fees doesn't have to be a difficult process. Jane has helpful suggestions on making it easy and effective. And finally, have you considered that having a thriving, profitable practice is one of the most healing things that you can do? Julie Bear Don't Walk has, and she can help you do something about it too. Do be sure to visit the sponsors page on the Qiological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more.
Hi folks, I'm Yvonne Lyle, president of Mayway Herbs. May is Women's Health Month, and as a women-owned and women-run business, we especially love how Chinese medicine can support wellness through every stage of a woman's life. So in this month's newsletter and podcast, we're covering topics like PMS, pregnancy, menopause, and osteoporosis. We'll share expert insights and effective treatment strategies you can put to good use in your clinic. Our Plumflower brand line includes herbal tea pills, tablets, extract granules, and organic herbs, all of which you can find on Mayway.com, and where you can also find articles, videos, and other resources to support your practice. Since 1969, Mayway has been a trusted source for high-quality herbal products. In these challenging times, please know that we remain committed to keeping our products accessible and affordable so you can take care of yourself and your patients. As always, thank you for supporting Real Chinese Medicine.
Daily habits and routines feel comforting, familiar, easy, automatic. That's the power of repetition. You've worked out the kinks and can do it with your eyes closed. But what if you shook things up? What if you ditched the old routine and tried something new? Hi, I'm John Sten. I've practiced acupuncture for over 30 years, and together with my wife Kelly, we created the world's first eco-friendly acupuncture needle. The AcuFast earth-friendly needle system cuts your packaging waste by 60 to 90%, depending upon your needle type, speeds up your needling, gives you more control, and best of all, while you're healing patients, we plant a tree for every 2 boxes your clinic uses. Thousands of acupuncturists have already made the switch. In just the last year, they've helped plant over 16,000 trees. Since we started, that number has grown to over 50,000. So break the routine. Be the change. Visit acufastneedles.com. Your patients and the planet will thank you.
Josh Margolis, welcome to Qiological.
Thank you.
Happy to have you. Yeah, good morning. Well, it's morning for us, and who knows, people listening, what time it is. This is the great thing about a podcast. You can just tune it in whenever you want to listen.
I'm down.
Yeah. So you're an acupuncturist. You're also an osteopath. I am so looking forward to talking to you about the interface of those two things. Before we get into that, I am so curious to know how you wandered in to the world of Chinese medicine. I mean, while a lot of younger people these days go right from college into Chinese medicine school because it's like not an oddball thing, for people that have gray in their hair, you know, it probably wasn't the first thing that we did.
Yeah.
What brought you to this?
Well, it was the first thing that I did. So I actually was an anthropology major in college and was looking at medical systems and how people interfaced with medicine. And this was all really fun and interesting until I realized that Chinese medicine was far more interesting in reality than looking at it in the abstract from the perspective of an outsider. So I actually left college to go study bodywork with the intention to go become an acupuncturist. I spent some time in Santa Fe, New Mexico, which was a great deal of fun, and that's where I was exposed to osteopathy ultimately, which kind of brought it all together early on. I was 19.
So you started off in anthropology. You were looking at it from this theoretical sense. What was it that sparked in you where you go, I've got to know more about this? Was there any sort of inciting incident? Was there an experience, or was it something that just over time took your attention?
I think it was ultimately the Tai Chi class I took at the time, and just experiencing the sensation of chi and the concept of energy, and really viscerally feeling that really, I think, took me to the place of going, who understands this? What is this thing that I'm experiencing? And really, since I was already kind of looking at this things from this abstract point of view, I said, it looks like the Chinese have this down. And that's really what brought me to Chinese medicine. I really wanted to understand the meridians, how energy moved in the body, and so on. Yeah.
Yeah. Came out of an embodied sense. No wonder you also caught into osteopathy. It seems like there's such a focus with that on sensation and palpatory sensing.
Absolutely. I mean, the practice of osteopathy really is a practice of palpation and interaction with sort of the dynamics of life as they're happening and unfolding in real time. Yeah.
Yeah. Well, this is something about osteopathic touch that for me is really interesting, because it truly, this is not a metaphor. It truly seems to be a way of seeing through your hands, right?
Absolutely. Yeah. I think the term that we mostly use these days is listening. There's a few notable osteopaths who've really kind of put that forward, in the sense of really being there and being kind of consumed in the experience, if you will. Consume's maybe not the right word, just fully there. And it's like listening to beautiful music,
It seems to me, when I'm working in clinic, I often have all these mental models going in my mind. What's going on with the patient? How am I diagnosing? What's going on for them? What am I going to do? Blah, 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 blah. And because there's so much chatter in my head, it's sometimes hard to really pay attention to what's happening for the patient. Now, I do a little bit of listening with my hands, but I found too that, like, just listening to what people are saying without a sense of like trying to make sense of the narrative right away, just like letting the information come in and giving it a moment to kind of gel is often useful. I mean, I just do that with like verbal. When you put your hands on people, it's like, what are you listening for? What are you doing? Or are you actually spending some time not doing? What's coming in? And how do you turn sensory information into something that's actionable in the clinical practice?
Yeah, that's a good set of questions. Assessment scan, for me, a patient comes in, and sometimes I don't even want to hear what's going on with them till after I've done a scan, because, someone tells me their left knee hurts, and then all I can feel is their left knee. There's really coming at it from as much of a beginner's mind each and every time and each and every moment is really important. So when a patient comes, I usually run them through a very quick assessment, really inspired and taken from the work of Jean-Pierre Barral, who's a French osteopath. And so I just rest my hands on top of their head and try to feel, what are they protecting? Where do they lean? And what do they just automatically try to guard? And then I might check for their first rib movement, the pelvic movement, and then I have them lay down and check the fascial tension in their limbs and how fluids are moving through the craniosacral system. And that's really it. It takes about a minute and a half, and usually gets me a pretty good idea of kind of what the body's really trying to protect, because what their pain is or what their complaint is not necessarily the most interesting place to work. So someone might say, oh, my ankle hurts, and I might go, gosh, your third cervical vertebra is really twisted up, or Oh, my shoulder's hurting. Oh, your liver's kind of jammed up, and maybe you're getting some strain on that phrenic nerve, which is C345, which then puts us in the zone of, rotator cuff muscles. So you can get those interesting overlaps, but the story often comes after my hands have told me where to go.
Right. You listen first without even knowing why they're there. You are a blank slate.
As much as possible.
As much as you can be.
Yeah.
Yeah.
Yeah. A good example is yesterday I had a patient I'd never seen before, and he had a very complicated orthopedic history, played a lot of football from 9 to 20 or so. And, just kind of as we were going, even after the intake, we kept finding injuries. He's like, oh yeah, I broke my sternum, now I know. I didn't know that. He hadn't told me about that particular injury, but that was a place that I was really drawn to early in the session, and was really relevant, I think, to what was going on with him. And, his body stores the story, really. It's all there.
Yeah. Well, this is built into Chinese medicine. We know, even if you've only studied a little bit, we know that where the problem is and where the complaint that brings people in is located might be two really different things.
Absolutely. Yeah. Acupuncture theory and osteopathy theory are very similar in my mind, in that you're really looking at both the local manifestation and the global pattern, which sort of brought it to be.
Mm-hmm.
And the trick is just learning where you can kind of like flick a little domino and set the chain reaction that makes for big change down the line.
Absolutely. This is, I think, one of the funnest things about acupuncture, and we all love those stories of that 1 or 2 needle treatment.
Oh, yeah.
That utterly transforms someone.
Yeah. We all shoot for those every time, don't we?
Well, it's not a bad goal to have, right? To be able to catch something in such a way that with a minimal amount of effort, the system will just take care of itself.
Absolutely. Yeah. You're sounding like an osteopath now.
Well, I'm an acupuncturist.
Yeah, no, it's very similar. Very, very similar.
It's similar. And I've studied a little bit. I've done some of the engaging vitality work,
mm-hmm.
which teaches some of this. And I have so many questions about it because, this touch is so subtle. One of the big questions I often have, and I still deal with, and I suspect anyone out there listening who's done any kind of training, especially with cranial sorts of touch, is how do I know when I'm actually feeling something? And how do I know when I'm just making stuff up in my mind? How do you differentiate between sensing and thinking you're sensing? Does that question make sense?
Yeah, I think that kind of lies at the heart of one of the big clinical challenges. When I like to think of the analogy of like wine tasters. There's those wine tasters who can sit down and say, oh yeah, this is clearly like a Western European wine. Must have been a cold year. I'm thinking maybe more Germany, short growing season, da 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 da. They can tell you
right. Yeah.
And they can narrow it down. And personally, I taste wine and I go, yeah, sweet, good, bad. But I'm still perceiving all of the things. I just don't know how to pull them apart. So at the beginning, when you start touching, there's a lot of room for the imagination to kind of set in. But as you gain clinical experience and you touch a lot of bodies and you start getting feedback, you start to really trust your touch in a different way. One of my teachers told me, Dr. Sannett, he says, I spend 0 minutes a day arguing with Steve Sannett. And I think, and I thought that was a really good way to think about it. We're not doing brain surgery here, really, in the sense that if you miss, it's not like your patient's head explodes or anything. You really just wasted a couple minutes and you gain some experience and you realize maybe that's not a path to walk down. Similarly with acupuncture, if you're practicing safely, you just wasted a little time and maybe a little of your patient's confidence, for a minute or two, if you try a point that's not going to have the kind of effect that you're looking for. Does that speak to your question?
Well, I think it speaks to a big question that probably all practitioners have, especially as we're getting started in practice or we're trying to learn something new, and that is how to know to trust ourselves. What in ourselves is trustworthy? What to pay attention to?
That's a much larger conversation.
Well,
Yeah,
but it really comes into our clinical work, doesn't it?
absolutely. I mean, we're doing subjective assessment, to a great extent. Pulse, I mean, it's very, very subjective who your teachers are, your own experiences, and so on. Uh, and osteopathic palpation is very similar, who your teachers are, what your lineage is, who the people that you have worked with, had the pleasure and honor to work with. If you work with kids, you're going to develop a different kind of touch than if you're working with athletes, and, the osteopaths, I have a colleague here in town who does the most rough and tumble myofascial release you could have ever imagined, and, there's the continuum to the biodynamic osteopaths around here who, barely touch. You barely even realize anything's happening except for you take a nap and you wake up feeling better somehow. So, there's a real range. But I think, knowing that there are really smart people who came before and have shared roads to look down, paths to look down, and then start with those.
Well, tell us a little bit about the path that you looked down.
In terms of a clinical path, or
In terms of how that informs your clinical work.
Yeah. So, the work continues to evolve. So now I mostly really look at just being with people as much as possible in the present moment, and to help them come further into that moment and realize that there's opportunities to change and there's an opportunity for change. I think a lot of people come to my clinic feeling kind of discouraged. I deal with mostly really chronic stuff. I'm not doing acute orthopedic stuff most of the time, sometimes, but not usually. So to just even settle down and say, like, let's look and see what's right and what can be even more right. The founder of osteopathy, A.T. Still, said, in about 1890, the object of the doctor is to find health. Anyone can find disease, or any fool can find disease, something to that extent.
It's a great quote, isn't it?
Yeah.
Yeah, it's an amazing perspective.
Yeah, and osteopathic manipulation in the last 70 years, 60, 70 years, has been moving more towards recognizing the health rather than thinking so much about what's biomechanically, quote unquote, out, like this vertebra is rotated this way and that this, maybe the liver's jammed up in this corner, or whatever. So it's more like, okay, what of these are adaptations? What of these kinds of mechanical restrictions are really more just throwing off the nervous system and not allowing for normal function? And so how can you prioritize how to unlock that health? And that's kind of the perspective I've been really looking at more and more these years. Earlier in my career, I did more, trigger point release and deep tissue and real intense tendinous work and even high velocity manipulation. And now I don't do those things probably 95, 98% of the time. I find I don't need to. And I find the results last longer when I'm not doing those things. So I've kind of moved from trigger points as like a pathological state to more like a cry for help from the body. And I use them more as an analogy being taking the pulse in Chinese medicine.
Mm-hmm. It's a marker.
Yeah. What muscles are overloading? How is it working together? How's the system? How integrated is the system? And so a lot of times, I might work somewhere else and the trigger point in the trapezius or levator scapula gone.
Exactly. Like you
Yeah.
put a needle in and the pulse just shifts from wiry to, just kind of nice and easy.
Yeah.
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 Well, I hear you speak about the health, and I've heard osteopaths talk about the health, capital H health. And it seems to me that they're talking about the very same thing that in Chinese medicine we talk about the zheng qi, right? The upright qi, the part of us that is healthy, that's always healthy, that's always available for at least as long as we're in this body.
Very much so.
And has that capacity to, if it's unblocked or unlocked, it just goes to work.
Yeah. Sutherland, the founder of cranial osteopathy, talks about the unerring potency of the tides, of the fluids in the body. How if you can interface with the fluids and activate them or help them activate more, then they'll just go and fix whatever needs to be fixed. You don't, as a clinician, need to do that work. That's not the work.
So when osteopaths are talking about the fluids like this, when I hear you talk about the fluids, could this be translated into, for a Chinese medicine practitioner, the qi? Or are we talking about something different?
I think the terminology is a little different. However, I think they're looking at the same phenomena. There's very much like in cranial osteopathy, sometimes the fluids can really mean like very much the jing, the jing, the essence, for example. So like working with kids with developmental delays, early fusion in their skull, poor growth, poor development. All those things are very much kidney jing related. On the other hand, working with like an adult with some kind of illness, sometimes it's more qi, or maybe it is even the yin or jin ye that you're working with. But the idea is that very much like the zheng qi, like you mentioned, that if you can support the upright, the body will heal itself. There's nothing more to do, really.
This episode is brought to you by Jane, the clinic management software that honestly just makes running a practice easier. Let's dive into something that's never easy, but sometimes necessary: raising your fees. It can feel awkward, right? But here's a tip that can really help. Consider offering flexibility to your patients as you introduce the change. When patients face new fees, it's natural for them to feel uncertain or concerned. That's where flexibility can really make a difference. Offering options like a phased increase, suggesting a payment plan, or even taking a moment to talk things through can help to ease the transition. These thoughtful gestures show your patients that you're listening and care about them, which strengthens the trust you've worked so hard to build. If you're looking for more ideas on how to navigate these kinds of changes, head to frontdesk.jane.app and check out the article, How to Tell Clients You're Raising Your Fees. One last thing, if you're ready to give Jane a try, you can use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. As we're having this conversation, it occurs to me that hydraulics are really powerful. I'm thinking about a pump that you could use to raise your car.
Yeah.
Right? I mean, hydraulics are like super, especially in a closed system, super, super powerful. So when you're talking about fluids from the osteopathic perspective, are we talking literally about hydraulics and how things push or pull or regulate things?
Yeah. It depends kind of on which maybe school of osteopathy. Osteopathy is kind of broad in the sense of Chinese medicine or Asian medicine, in that, you can get 20 people in a room and have 20 totally different ideas how to use the same points, even having all read the same books and having their similar roots. So that can be very much like lymphatic movement and movement through the different diaphragms, like the respiratory diaphragm or the thoracic inlet outlet and so on, and moving the fluids through the cavities. It can be very much working with the pressure within the craniosacral system, within the dura, which changing the ability of the brain and spinal cord to attain or gain nutrients and get rid of wastes. It can be quite profound. Or you can look at the work of Jean-Pierre Barral, where you can get down to manipulating every single artery in the body, or there's a lot of lymphatic work out there, and it's really an expanding area, all mediated by fascia ultimately. And that kind of is the kind of core of modern osteopathy, is moving more and more towards understanding the fascia and all the nervous and fluid things that are happening there.
Right. I was talking to one of my patients the other day about the fascia, because it's kind of in the news. I mean, people are hearing about it, fascia connective tissue. And I can't remember which one of us said it, but the term came up, said, yeah, it's like the internet of the body.
Yeah.
Right. It's this information network that connects everything.
Yeah. I mean, back when I did anatomy, it was the stuff you threw away and kind of knew it was, you knew it did something, but it wasn't that important. And now you're starting to realize that, the interconnection, communication in the body is much more dynamic than we ever thought, which is, I think, why the application of a needle, far, far from the site of the disorder or pain or small amounts of pressure, adding small amounts of pressure into the system can have such huge effects throughout the whole system. If you can get to the right place, if you can listen to the fascia, if you can find where that, I kind of like the term therapeutic leverage is kind of what I've been thinking about, that place where just with a very small effort, you can have a huge effect through the system.
Exactly. Well, I mean, as acupuncturists, our job so often is finding the right point, right? It's like, where is that point of influence that will make the other dominoes fall? And then the next question becomes, how do I interact with that point? Yeah.
You have to give the body information it can use. And
I like that term, information it can use.
Yeah. So, you can approach things a couple different ways, right? You can come at it like, okay, hey, body, you've got this imbalance. You're trying to compensate over here. Let me give you a hand over here and kind of help you and go the same direction you're trying to go. Or you can kind of come at it and say hey, well, let's try to go this way gently. Or you can do it more forcefully, and you have a range of possibilities. Sometimes someone's levator scapula is in such spasm. I mean, I find that often the gentle stuff's not enough. He's got to get a needle in there and stim it up, even though to my mind it's a little like slapping a crying kid, in the sense that the muscle is trying to do you a favor. Usually, it's just overloaded at that time. But sometimes you gotta shake it. That scene in Airplane, that movie, comes to mind, where they're waiting in line to stop the woman who's crying. Let me have a turn, and they slap her one after another. Remember that movie?
I remember hearing about the movie, but I actually never saw it.
Oh, wow.
Maybe I should go watch it. That was from the 80s or something, right?
Oh, yeah. I tried to watch it with a German friend once. He just didn't get it at all, because it was all based on pop culture from the 70s and 80s in the U.S.
Yeah, okay. I'll have to put it on and watch it with the 14-year-old niece. I'm sure she'll enjoy that.
Perfect.
Yeah. I want to come back to something that you said earlier about putting your hands on people and getting a sense of what are they protecting.
That's kind of the key to how I work these days. If you stress the body lightly enough, it'll show you what it's trying to protect. So it's like asking a gentle question, or just looking someone in the eyes and connecting with them for a moment, to make an analogy, and just saying hey, what's up? And that might be a stressful question to them.
Oh, absolutely. I'm thinking, I had this happen the other day. A friend of mine from Seattle long ago was here in St. Louis and came by to say hello, but also needed a treatment. And I remember her looking me in the eye and going, how are you? And that's very different than someone just walking in and going, hey, how you doing? Right? She looked me in the eye, How are you? And it was a whole different thing.
Absolutely. So the trick there is to not get in there and not weird people out, because sometimes if you give too much eyeball, you'll freak somebody out, right? So you got to kind of meet them where they are, and that's the idea. And so by compressing the head and compressing or twisting the tissues lightly, I'm trying to get in that place where they can just go, I'm really, really hurting over here. This is the thing that is kind of bothering me. And I really, trust you, and I can show you this thing that is, vulnerable. And that's where the gentleness, I think, of modern osteopathy really comes in, is really getting to that vulnerable spot. We're not thinking on that orthopedic level. I mean, certainly I do. It's a map that I use. Like, hey, I need to make sure someone didn't rupture a tendon or, really, break a bone or has some like severe nerve problem that I need to have looked at and make sure they need to see a neurosurgeon. And then I put that aside and I look, okay, how is the body asking me for help today, this moment? And it's an ongoing, unfolding exploration, which will change as you pull tension off of one area. Then something else might come up, and then something else might come up, and then something else. And when the body stops saying, hey, help me here, then we're done. That's what we need to do for the day.
This sounds so simple. And yet, I know for myself, it's very easy when I get a hold of something, I go, oh, it's this. Now the rest of the mind kicks in. I got a diagnosis. I do this. I do that. It's easy in that moment to stop paying attention to what the next thing is because I got this thing. How do you train your mind for this? Do you meditate? Is it because you've been doing this work for so long? Is it the teachers that you've had? How can we continually stay open to our experience even as we're in there and interacting with the system and change is happening as we work?
Yeah, that's a good question. And it's a challenge in my practice too. I mean, I want to just go, oh, your knee hurts. Let me really look at your knee. Let me get my microscope out. We're going to find the exact little tiny nerve that's cranky in your knee. It's an ongoing challenge. But I think kind of the Zen maxim of, beginner's mind is just really always starting over and always trusting your hands. So what I try to do is, okay, I feel something, then I go back and feel. I use one of my parameters. At the beginning, I do the standing assessment, then I do the torsion traction through the limbs, then I do a craniosacral. Maybe I check the visceral movement, and then I'll come back to one or more of those and just see if there's a different pull. Sometimes I can feel from where I am what the next step is. It's the body will say, now that you got that C3 vertebra moving a little better, I really want you to look down over at the left side of my diaphragm. There's something over here, why don't you poke around over here? And then I roll over and play around until I find something that's interesting. And then work that for a little while and then let that come back. And then I might come back to my parameters again and then bounce back and forth. But I'm often in a flow state, through my work day. I find that I don't really get stressed at work because I'm basically in a meditative state for at least half of every session, if not more.
I love, you just used the term playing around, right? I play around. I like turn over, I play around. And it's easy to hear that and go, oh, you're not taking it seriously. But there's also the way of listening to it as, yeah, you're inquisitive. If you've ever watched kids play, they're totally attentive and in the moment to what they're doing.
Kids are working really hard. All that play is really training your brain in a big, big way. And I think there's no better way to get experience than to get experience. And the way you get
There's no better way to get experience than get experience. I'm gonna quote you on that.
Yeah, you can have that one. You have to actually, in my mind, be inquisitive all the time and be a healthy skeptic. You need to go, okay, I'm experiencing this thing. What's there? It's just simple science, right? You have a hypothesis. I feel like there's this tension down coming from the knee, even though I'm way up here on the neck. Or, all right, let me go look at that knee. Well, maybe you don't, maybe it's not at the knee. Maybe it's a little higher, maybe it's a little lower, but you got in the ballpark, and then you go, okay, now I know what that feels like a little bit. And then the next time there's some similar pull, you can kind of go from there. It's how it's really how I approach the clinic. It's always playing around, and it's fun adventure for me. Like if you tell me, someone comes to me and they say, oh gosh, my knee hurts. I'm not going to go, well, it's probably your right kidney. I have no idea what's going to come up until I get to work. And I really strive to maintain that. And it's fun when I go, okay, oh, looks like your right kidney. And I do a tiny little manipulation on the kidney and their knee pain changes by 60, 70%. Then I go, wow, that's a data point for me. And that's the playing around. I just sort of file that in my thing, like, okay, I can trust my hands in this different way now. And over the years, I trust my hands more and more and more and more. And the weirder things they tell me, I trust. Whereas before I'd be like, I'm going to test the laxity of this ligament, and I'm going to test I'm going to test the strength of this muscle, and I'm going to do this very kind of objective orthopedic type tests. And now I do that stuff more just for my chart notes. If they had an accident, I need to write that down. But for me, it's often not that interesting.
It's easy, I think, when we have something weird come up and we follow it and it pans out, right? There's something very satisfying about that, right? I mean, we feel like we're competent. It's like, oh, I'm getting this. I understand. What do you do in those moments where you follow something and you just hit a dead end? How do you keep yourself on track and not like go off the rails of, oh God, I don't know what I'm doing?
Yeah. So I just change models, so if I've been doing the woo-woo osteopathy thing and kind of just feeling around and I'm not getting results, I'll step back and just say, okay, either I need to assess what I'm doing here and like try to clear my brain and do this again and come at it from a fresh perspective. Or I'll come and say, look, I'm just going to do another ortho exam and I'm going to treat the trigger points, or I'm going to just go more like mechanical, because sometimes that's the best place. The trick for me is to try to interface at the best level for that patient, that particular day, that particular time, that particular condition. Very much Chinese medicine type of approach. And so sometimes I miss the right level. It's like the problems in the sinew channels, and you're at the deep divergent channels. You might get some effect, but it's not the place where you're going to have that shift that you really want to see or expect to see. So then, I had a patient, I treated her lightly a couple times, and we would get these nice results on the table, but it just didn't hold in the way that either of us would like to see.
Mm-hmm.
So, I said, look, roll over. And I needled, the Huatou Jiaji from L4 to S1 and got under her sacroiliac joint with a 1.5 inch, 2-inch needle, and, did all this kind of orthopedic needling. Then we came back and were able to do that gentle work because there was just such a big interference to her nervous system that it just couldn't work for her at that moment. Other people I've had great success with. It's not to say that it's a universal thing. It's just at that moment, that was the appropriate way to treat her. So I had to step out of my preference, which is to be gentle and in this flow state, and go, hey, we're going to do a little tough love. Let's see what happens. And then let's see. Oh, great. Now we got your lumbar spine to feel better. Now we can do this release, this gentle release. The psoas will stay released, and the hip flexors, and we can bring gluteus medius strength on, and all those sort of target goals. But it's playing, if I play in the wrong game, I just need to change it up.
Change the game.
Yeah.
Change it to a different game. I remember when I was in acupuncture school, one of my classmates did a treatment on someone, came into the supervision room and said something to the effect of, I really like the treatment that I did for the patient. And I remember the supervisor saying to this person, I hope it was helpful for the patient as well.
Yeah, it's a,
And I was like sitting there on the other side of the room going, wow, I just got a lesson without having to be like in the direct line of fire.
yeah,
But
that,
it's so true. We've got what we love to do. I like this thing, but
yeah,
it may not be what the patient needs at that moment.
yeah. I think that's a key thing to physical medicine, and physical medicine meaning acupuncture, osteopathy, chiropractic, physical therapy, all those things. Really, how do you match your patient in where they're at? The analogy I like to use, sometimes it feels like some treatments are putting ice on a campfire. It'll it'll put the fire out, but it makes a lot of smoke. The water, just plain water works better. Just you don't have to pull out the biggest, baddest tool just because you can, and you don't have to depend on the most subtle tool that sometimes it's like, okay, yeah, the Grand Canyon was made by water, but that might take a really long time to get from here to there. So having that clinical flexibility, I'm like, okay, the patient's in pain, and I'm doing this like woo-woo gentle stuff that, I think will really help them. But I can put a couple ear needles in and, their pain will shift. I can do some distal acupuncture at the same time and their pain will shift. And that gets the patient on board. And sometimes that's enough to really kick the healing process into it. They're like, hey, this guy's paying attention to me. He's listening to what I have to say, and that, hey, my ankle hurts. That guy like took a minute and stuck a couple needles in my ankle and cranked up the electric juice. He means it. We're gonna get better.
Yeah, the approach that we take and how it connects with the story and narrative of what a patient is expecting, I suspect has something to do with it as well.
Yeah.
I mean, I can think of some patients I've had I work really well with, and one of their friends comes in, and this friend has a completely different personality. I cannot work with them the way that I worked with the person who referred them because it just, it would be like one of us is speaking German and the other one is speaking Swahili. It's like you got to speak a close enough language that you're connecting with each other.
Yeah. One of my early mentors, when I graduated from acupuncture school, I actually went and apprenticed with a chiropractor rather than another Chinese medicine practitioner. And he was amazing, amazing at getting people. We would walk into a room, and this was the main part of my training. I wasn't learning chiropractic from him. We'd walk into a room, and he'd say, hey, how you doing? And they'd say like 4 sentences about themselves. We'd walk out of the door, him and I, and he'd say, what's going on with them? And I had to give him a physical assessment, emotional breakdown. And they were just sitting in a chair like across the room, 15 feet away from me. And that was my training. We do that 4 times an hour. I just walk in, he'd say, what's up? They'd say something vague usually. And I had to go, well, they've got this going on and that going on. And that was amazing to see how much one can perceive if you really pay attention. And a lot of it was, just so those first impressions. It's not that I'm necessarily right about all of that, but it's interesting how much people will show you and tell you about themselves if you let them, if you let it in.
If you let it in.
And they'll tell you right away who they are most of the time.
Having a thriving, profitable practice is one of the most healing things you can do as a healthcare practitioner. Because a robust business is the ultimate expression of vital chi. And that's the heart of our medicine. I'm Julie Bairdontlock, and I help practitioners grow nourishing, profitable, authentic businesses that embody the generative cycle of Chinese medicine. This isn't about all yang all the time. It's about expanding your own internal capacity, growing collaborative relationships with your patients for ethical patient retention, and marketing as an extension of this medicine, not a necessary evil. You already know that everything is connected in your patients' lives and bodies. The same is true for your business. When we align your systems, your schedule, your pricing, and your offerings with you, we create flow, which means more spaciousness, more impact, and more joy. When you are in the flow, fully resourced in terms of chi, time, and money, your business becomes a source of healing, not just for your patients, but for you. Let's grow something rooted, radiant, and real. Visit lifeflowconsulting.com to learn more.
So the trick with this is not that the information is not available. The information's there. It's us taking our filters or barriers down to it so that it can come in.
I think so. Yeah. And you got to run it through different software. You got to run it through the orthopedic software. You got to run it through the mental emotional software. Is this person depressed? Are they sleeping? Are they, do they have good health habits, if you will? You got to run it through all the different things so that you can figure out how to meet them and make the most impact. Their goal is, theoretically at least, that's why they're coming to the office, is to get better, right? In some way, to improve.
Well, they probably want to get rid of something they don't want, or they want to get something they don't have, generally speaking. It's one of those two things. And not always the thing that they say that they want when they come in the door.
Oh, yeah. I want to lose weight, but I don't want to exercise or change my diet. What do you got for me, Doc? Can you put a staple in my ear? So figuring out those sort of leverage points. And that's what I really got from my mentor it was chiropractor. I remember one time we would talk to this older patient, a guy in his 80s. And, he was going through that contractile phase that people do towards the end of his life. He's starting to lose his autonomy, and, he had stopped working in the last year or two, and his daughter wanted to get rid of his desk. And that was the desk, from which he had, sort of ran his empire, his business empire, his whole life, and
gosh, he wants to rip his heart out.
It was like ripping his heart out. And that was what there's a chiropractor. This is what we talked about, this is what we talked with the guy about, because that was the place really where he was hurting. His back hurt, but that was really the thing that was much more important to him. So that was the conversation we had with him, or my teacher had with him.
Mm-hmm.
It was really around, hey, maybe you should keep your desk, is there room? Yes. Then keep your desk, there's nothing wrong with that.
Sounds like you love that desk.
Yeah, it sounds like you love that desk, and it puts meaning in your life, So I think finding the ways in which you can kind of enhance that health, it doesn't matter if the guy has the desk or not, really, for the outside world,
Right. But for his inside world, it makes a huge difference.
For him, it was super important. And he brightened up when he was like, oh, that's possible. That's something I can do. He had kind of gotten stuck in the idea that he had to get rid of it.
Yeah. I'm intrigued about this because we also hear of, the great doctors, the masters, who basically look at someone like your teacher there, your mentor. You have a few words, maybe you take the pulse, and bang, there it is, right? You've got so much of what you need. I suspect that many of us would love to have that kind of a skill, or that kind of a perceptual, I don't know if framework is the right word, but have a sensorium that can absorb that sort of information. Any suggestions for those of us that are not astute at that? We got to talk to our patients for a half hour before we find out, oh, they have a desk. How can we learn to open ourselves up to that kind of a sensing?
I think really listening.
We're back to that.
I mean, it always comes back to listening, and really paying attention to the body language, everything. Your patient really tells you a lot right at the beginning, and it's it's a hypothesis. It's not, I don't think, I don't presume to know somebody. I just go, okay, this person is maybe a little nervous to be here, or feels really comfortable, or is like a total extrovert and wants to like overshare about every detail of their internal experience. And, my job is to meet them there, and really connect with them from that perspective. From that, then it's just playing around and testing your hypothesis, and make it fun for yourself, and it doesn't have to be wacky, it's like, check the pulse, see what you notice, then use a different tool, palpate along the meridians you feel that are off on the pulse and see if there's a lot of tender spots. Well, that starts to tell you something. And then, ask questions or notice how those points feel. If you're feeling like a wiry pulse in the liver gallbladder position, do you notice tension in the channel? Or do you notice at one end of the channel it's really mushy and gushy, and the other end it's tight? Or if gallbladder's tight and liver's soft? Or if you feel like a kidney deficient pulse, do you feel the weak? Do you feel something? Is there bogginess in the tissues? Is there empty feeling? Sometimes I've seen with some chronically ill people, you get to the kidney 3 and it's like there's a hole, there's nothing even there, and okay, it's like, is that a point that I could then maybe needle? Maybe there's not enough of a reservoir there to interact with, so needle it a few times, build up your thought. Oh, that didn't work, that's a moxa patient, now and you'll say gosh, I'm going to send this patient home with moxa, or I'm going to use herbs until I feel those points thicken up. But you just have to make your own internal database. So what you're going to experience and what I'm going to experience are different. I can share my path, and I can share my thinking, and I can share some ideas, as can you. But what I'm going to perceive is based on my biases and my experience. And so I think really just for me, it's just been, I just go and I treat, I test, I treat, I test, I treat, I test, I treat, I test, I treat, I test. And now that testing can be more subtle in the sense that it might not look like I ever stopped treating. I might just still be in motion on the person's body, but it's still what's happening. I treat, I test, I treat, I test, and then, gain experience.
And it sounds like you're not getting caught up in I was right or I was wrong. You're just going along and being inquisitive, seeing what happens. Do something, see what happens. Because, it's so easy. I mean, I know from myself, and I hear this from other people. You get caught up. It's so easy to get caught up in, oh, I'm wrong. Oh, I don't know what I'm doing, blah, 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 blah. Or the opposite, which is equally not helpful, which is, oh, I'm right. Look how smart I am.
Yeah.
Both those things are not helpful.
Yeah, you cut yourself off from experience.
Right.
And
there's no better way to get experience than to get experience.
There's no better way to get experience than to get experience. Yeah. But you have to be open to experience. If you just go, okay, I'm looking for this kind of thing, then that's what you're going to find or not find. If you open yourself up to what am I feeling? What am I really feeling? Then the possibilities are much, much greater, for what you might experience. And sometimes you go, I don't know what that thing is I'm feeling. And that's an avenue for more exploration.
Mm-hmm.
It's like, oh, okay. Sometimes I'm working on somebody, I'm like, that's what Dr. So-and-so said about that. I could never feel that thing. I just never experienced it. And I'm like, is that? Am I? And then let's explore. Oh, is there a point of therapeutic leverage here? Is there something interesting? Or am I just imagining it, like you said earlier, and sometimes it's a little of both,
Yeah. Well, I love the idea of treat and test and treat and test. Do something, and did something shift? Something that was palpatory, something that I was paying attention to, something that I can go back to? Is it different? I mean, tongue and pulse are classics in Chinese medicine.
Perfect.
Right? I mean, they're great. And even though I often heard in my younger days when I was training that, tongues don't change that quickly. Oh boy, howdy, can they ever?
Yeah, you can definitely see change in moisture and vascularization coating takes a little longer,
I
but
have
yeah.
seen coatings change dramatically.
Yeah. On
Yeah.
the table?
On the table.
I'll have to look at more tongues.
I mean, to the point where these days I am writing down much more carefully what the tongue looks like, because otherwise I have at times looked at a tongue and gone, I must have been dreaming when I looked at their tongue a few minutes ago.
Oh, I'm gonna have to explore that. I like that.
I would encourage you to explore it, because in tongue coating, I mean, seriously, I have watched thick tongue coatings go fairly thin in minutes.
Wow.
I know.
Wow.
It blew me away. It was like, this is not supposed to be happening.
Right.
So again, it's helpful to have some markers. And for me, it's helpful to write them down, because
Oh yeah.
otherwise it's easy to get confused or lost. I mean, I got so much chatter in my own head. If I can get a few things down on paper that I can refer back to, it's really, really helpful.
Yeah, absolutely. I mean, the notes are really important.
Yeah.
That's interesting about the tongue. I'll have to add that in. These days, I do so much of my assessment just physically. I don't look at tongues a lot unless I'm going to give herbs, which I don't do probably half the time. So
Yeah.
I just stay on the physical, on the body. Yeah.
Play around with it. See what you find.
Yeah, I will.
Yeah, it's
Thanks.
an option. You're welcome. Hey, I'm going to just move this. I'm going to divert this just a little bit, because I heard you use the words divergent channels a little while ago. And divergent channels are one of those things that we covered briefly when I was in school, and I never understood them then. And I can't really say I understand much about them now. Is this a piece of your practice that you do on a somewhat regular basis? Have you got anything you can share with us about these channels?
Yeah, I was fortunate enough to study with Dr. Bouch in Petaluma, who was one of the instructors for the physician's acupuncture training.
Oh, yeah.
So I learned a lot of this quote unquote French acupuncture from him, French energetics. And the way they use the divergent channels are for really dense problems. So when there is more structural change, when there's measurable change in the tissues you're trying to affect, then that's when you tend to use the divergent channels. So for example, like in an orthopedic thing, you might use the kidney bladder divergent channels. And usually you do the yin yang pair at the same time. There's an opening point and then a collecting point that's higher. All the divergent channels go from inferior to superior. And you would open those up. So like for like a severe disc problem, you might use, kidney 10, bladder 40, and then bladder 10, which is the meeting point of those two channels. And that would be like an input, for the lung and large intestine, it's lung 1 and large intestine 15 up to large intestine 18 on the neck. So, you might run current from those, electric current or something like that. They like a lot of they use electricity a lot in that particular tradition. And you might run electricity from the kidney 10, bladder 40 up to the like Watojaji points or, Baliao or bladder points, whatever's relevant to that particular back pain you were working with. Or, you might be using it for like interstitial cystitis, for example.
Oh man, that's a tough one to treat.
It is.
It is.
So you use it for the when there's organs. So that would be the same input, bladder 40, kidney 10, bladder 10, and then you might wire it up to, you could either do them side lying and you could try to get it to CV3, or you can also get the Baliao, which are also really effective for, but you got to get them deep into the.
No, I mean, it sounds really deep. You're really getting in there. Yeah.
So that's kind of how I use them. So, they use all the levels, from the Jing, the Luo, and so on down to the divergent channels.
Do you work much with the 8 extraordinaries?
Yeah, I do. I use a pretty limited set of point prescriptions in my practice at this point. I remember one of my teachers told me, something to the effect of like a young doctor knows 100 prescriptions for one disease. An old doctor knows 100 diseases for one prescription.
It's so true. When I first got out of Chinese medicine school, I think I had roughly 100 raw herbs in my clinic, and I thought, man, when I'm really good at this, I'll have 300.
Yeah.
Yeah, no, I got fewer now than I did when I started.
And you get better results probably.
I like to think so.
You hope so.
I hope so.
Yeah, so I use a pretty limited point formulary. So I do use the extraordinaries a lot. I find that they often are really effective for a lot of conditions. And then I use, I had the good fortune of studying with Richard Tan about 20 years ago, right when I got out of acupuncture school. And then I kind of combined some of his methodology with what I learned from the medical acupuncture community. And that really gets me I've kind of narrowed it down to, it's sort of like if it's a Xiaoyangi problem, I pretty much am using these set of points, and I don't think about it too much anymore. And I find I get good enough results. And if I need to, if it doesn't work, then I play around, I figure something else out, and that's, that's kind of how I do it, But my practice now is probably 70-80% manipulation and the other 20-30 acupuncture. And I'm using herbs very much adjunctively at this point. I'm not doing a ton of internal medicine. Some, but not a lot.
Well, it sounds like if you can get the system to take care of itself, it just takes care of itself. And in fact, I think it was A.T. Still who said something to the effect, you'll probably know this better than I do, that the body has its own pharmacy inside. It's just our job to unlock it and get it what it needs.
That's almost exactly what he said. Yeah. Every unguent and potion is there, something to that effect. Yeah.
Right. And, when you think about neurotransmitters and, just how things work, all these little interlocking mechanisms in the body, if there wasn't something already there, why would a drug work the way it does?
Absolutely. Yeah. Every drug fits into at least imperfectly into a receptor we already have.
Exactly.
Right?
Yeah.
That's how it works.
It sounds like you've been doing some teaching lately.
I have been, yeah.
Tell us a little bit about what you're doing with that.
Sure. I'm teaching some basic osteopathy for mostly massage therapists and acupuncturists. The courses are kind of my favorite stuff that just really works, with a focus on things that people probably aren't doing already. So, one of my favorite things to tell people is, 2/3 of your body is in front of your spine.
This is hilarious, right? I just love these moments where I hear something and it's like, oh, right.
Yeah.
Now that you mention it, that's obvious. How come I haven't really paid attention to that?
Yeah. So you might surmise that many problems that manifest as a back problem or a spine problem are in front. Maybe not exactly 2/3, but probably a lot.
Maybe more than you're giving credit to.
A lot more than you're giving credit to. And if you look at traditional uses of like abdominal points, they often are back pain and so on. So I'm trying to pick techniques that I find are quick, effective, and can be applied either in a seated position, sort of before or after a treatment, needle treatment, or with the patient supine. So a lot of the techniques are my favorite because I can stick needles in someone and then do them. So I'm not teaching a lot of muscle energy or things where people have to be you're kind of pretzeling people up and putting them in these kind of awkward positions. A lot of it's very simple to apply to a supine patient, which lends itself to clinical use by acupuncturists without adding too much time in your clinical interface.
Right. I mean, they're already hanging out with needles. You're just going to do a little adjunctive work there.
Yeah.
Or maybe more than a little adjunctive work.
It might be more than a little. I mean, sometimes I'll put needles in and they'll sit with the needles for 20 minutes or 30 minutes, and then I'll be working on them during that time. So hopefully, so I've done some teaching locally here in Sonoma County, and then looking to kind of expand that out in the next year or two out around the country. It's very exciting.
It sounds exciting. Yeah. It's such complementary work. And I think there's already plenty of acupuncturists out there that know something about either massage techniques or Tui Na or manipulation or osteopathy, cranial, all that kind of stuff. And we know that these things, they fit together well because they're actually not different. They're just slightly different applications of the same thing.
Yeah. When I was a kid, I had the World Book Encyclopedia. Do you remember that?
Oh, man, I loved the World Book Encyclopedia because, in those days we didn't have the internet. We had like 5 channels on TV. You had to get up and walk across the room to turn the channel at that. But I can remember having entire like Sunday afternoons. I would just like go pull out the, letter P encyclopedia.
Absolutely.
And just like hang with it and read and just be absolutely entranced. It was so good.
Yeah. So do you remember the dissected frog or the dissected human?
Oh, yeah, with the transparencies?
Yeah, those were amazing.
They're great.
So those little acetate sheets are kind of how I look at the body. It's sort of like what level you're looking at is what you're seeing. And so you can literally just change your focus to a different level. And
right.
So
different maps for different terrains.
Yeah, it's like the map is not the terrain, but the map will help you. And so it's like, okay, I'm going to look at a Chinese medicine view on this. I'm going to look at an herbal view at this problem. I'm going to look at, a balance method acupuncture. I'm going to look at, some of the Japanese acupuncture that I studied. Just flip through and just like, okay, which one has the most accurate map? And I always love those acetate sheets because, you stack them up, all those layers are still there no matter what one you're looking at. And so how do you kind of interface with that? So
you do like to play, don't you?
I love to play. Yeah, absolutely. Absolutely.
Josh, thank you so much for taking the time today. I've thoroughly enjoyed this conversation. I am looking forward to Monday morning, and at least for myself, having a small interaction with patients when they first come in, especially if they're new, and then somehow giving myself a moment to digest that and go through what you and your mentor did, which is see what I can get before I get too much more involved with them.
Yeah.
I think that'll be fun.
It'll be a lot of fun. Well, thank you so much for having me here, Michael. It's really been great talking with you.
Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.